I think it's nice to actually try and to learn from each other. So feel so to space to take space and to learn chance to each other. I have a few I for sure want to share with you. Yes. Okay. So welcome. We're really grateful that you're all here. It's a special day because it has been quite a while that we came together like this at PHM Europe to meet each other, but also discuss where we are at and what would be good to do as a movement. So that's the main topic of the day. So we are going to create a day and we're going to analyze together, but also put forward a path for coming years. And first, we will start with a short introduction on like what PHM is, how it works, because we have new comrades in the room. For some people, it's the very first time they attend the PHM meeting. For some people, it has already been a story of a lifetime. And we will have an exercise with Kim, who's a comrade and artist with us, and then we're going to discuss together on how to move forward. So I'll just start. My name is Juliette Mattijsen, if you haven't met me yet. I'm a health activist. I work in climate and health. I do a lot for Palestine and do education and research in health justice. And Mathilde Kroon, who will introduce some later, is also facilitating the day, if you haven't met any of us yet. I'm not. So what is PHM? That's a very difficult question, and Alan reminded me yesterday that the answer to the question differs also to whom you ask. But I would say, in the first place, it's a movement of movements that struggle towards health. It's with the belief that health is not someone you can just choose for, but it's also something that's socially determined. So I love this this tips for better health from the struggle for health, which is like this is the approach we get taught in most health schools, like you can find like don't smoke, follow a balanced diet, keep physically active, and you can be healthy then. But what we believe is you cannot choose to be healthy if in certain conditions you cannot choose your way out of poverty. So this is the reply: don't be poor, don't have poor parents, own a car, and possibly my favorite: learn how to fill in the complex housing benefits asylum seeker application forms before you become homeless and destitute. Yeah. And I think that shows that that we need to improve. We can only achieve health if we do it together and do collectively, and that health is socially determined and also political. One important document in the history of PHM is the Alma Ata, which is a document that was accepted in the at WHO and not accepted in a neutral, like in a time outside of the political narrative. So it's the WHO was created obviously in a world that was already colonized. So who wrote the health rights documents was not all people in the world, and also amidst of the Cold War and the battle of ideologies. Alma Ata was also, it's in the former Soviet Union, and what the countries of the world agreed at that moment is that they reaffirmed the right to health, and for the first time they acknowledged that the existing gross inequalities in the world are morally unacceptable. That's not in the constitution of the WHO, but it is in the Alma Ata. And lastly, the path towards health for all is, if we want to realize it, we need to redistribute wealth and power over the world and have access to primary health care. So this vision is a vision that is supported by the PHM. The promise that was that health for all would be realized. So we were going to restructure the world in order to achieve health for all by the year 2000. Well, that's obviously didn't happen. And that's why people of the world came together, workers, health workers, activists for health, in 2000 in Bangladesh, and it was a big meeting. I wasn't there, but some of the Scottish obviously I wasn't there. But there they created a vision on how health for all can be achieved. This is a core document of PHM. It's called the People's Charter for Health. And if your organization or movement kind of agrees with this, then you are part of PHM. So we are based on movements, networks, initiatives, organizations that support the Charter for Health. So what's principle in this? So one, that health is political. I think that's something we just agreed upon, or that we just said. The second thing is that health for all means that we have to challenge powerful interests, and the globalization has to be opposed, and that political and economic priorities have to be drastically changed. Also important for the right to health is it's like nothing about us without us. So when we struggle for health, we always struggle for health. In the first place, the struggles are carried by the people who are affected. So we don't do anything without the people that are affected in the first place. Then we do not reduce health to healthcare. So we tackle the social, political, and commercial determinants of health. Watching out for the tyranny of the averages. I think that PHM is also a movement that allows different realities and lived experiences to realize health for all. And then also we make a big distinction in access to health, in the difference between universal health care versus universal health coverage, which is a reduction of the care for all principle. Yeah, so I included some pictures just to give you an idea. So I think we are represented in more than 70 countries all around the world for 25 years. We have comrades from different country circles that have struggled for health for a long time. And after the Charter for Health, every 5 years, more or less, PHM comes together, always in the Global South, and they organize the People's Health Assembly, where you revise this charter in the context of the time. So the Charter for Health is always a core document, but every assembly we look at what's happening in the world and we discuss the priority from there on. The People's Health Assembly 5 was held in Mar del Plata in Argentina, around the concept of when we hear the good life, if I translate it for you to the language that we speak here, which see health also as something spiritual and relational. So I cannot be healthy if you are not healthy. And I'm only like healthy if the world around me and the relations in the now and the future and the past are acknowledged and respected. So from there on, we revise the Charter for Health basically. So also important that we're explicitly anti-colonial, anti-capitalist, anti-patriarchal, and anti-imperialist in our actions. Yes. Oh. So how is the movement structured? It's very diffuse, and there's also many different people that are joining the movement, as I was saying. So from academics to fishermen to people working on the land. So it really differs a lot. We have a lot of different people that are parts of PHM and that represent PHM. On the global level, we have a steering committee that's, let me think, that basically makes sure that these big documents, that they get diffused to the other regional groups or the thematic circles, so that we have a vision and they make sure that we realize the vision together, and they also have an overview of some global campaigns. In the steering committee, there's a representation of all the other things, so the programs, the thematic circles, the regional groups, and some other members, I think. But they come together once a month, once every 2 months, just to make sure that we are realizing our ideas. Then on the global level, there's also thematic circles. I'll come to that in a bit. The programs also, and People's Health Assembly is kind of, I would say, more or less the decision-making process, but it's more creating the narrative together, which we do once every 5 years. And these are the regions of PHM. And that's what we are. We are a regional group from Europe. And in the regions, you have thematic groups, also common campaigns and regional meetings. And we are mostly active on the local and national level, of course, because we work with the people. And every level you go up, it's not super easy to work directly with the communities. But I think PHM is strongest in its struggle on the local and national level. So these are the programs that we have. I don't know a lot about everything. So I don't know a lot about Help for All campaign, but if anyone does, please, I'll give you mine. Then we have the IPHU, which is the people's health universities, which is a way to build narratives together and to build capacity for the struggle for health. And that's where we teach and we educate and we learn together this anti-capitalist, anti-colonial narrative, and also how we're going to change the world. They're sometimes organized in country circles, sometimes by regions, sometimes by thematic groups. There will be one this year online for sure. And maybe also something to think about within Europe. Do we need, would it be nice, and who could organize like an IPHU to build the capacity for our movement and within which themes? There's the Global Health Governance Circle, which does various things, but basically keeping track of the global health governance in the world, what's happening within WHO, the health WHO watch. So every year we send people to the World Health Assembly to see which decisions are made there and narrate these decisions to explain how they fall within our narrative. And by that I mean that the narrative around health obviously is very different than the narrative PHM has, but we keep track of all the decisions that are made and we place it within our own context, which is anti-capitalist, and that's how we also try to influence, I would say, sister movements in this way of looking at health. And then every 1-2 years, there's also a publication on the state of affairs on health. It's called the Global Health Watch. And there was the most recent publication, it's called Global Health Watch 7, Mobilizing for Health Justice. Yeah, that's also an analysis of our time around which events are also organized. And then we have the public pharma program. Ellen is coordinator of that. We spent our Friday around that. So if you have any questions or are super inspired by it, which you should be, then you can ask Ellen more questions. Does someone want to say something about the Health for All campaign? Yes.
I just think it relates to the 7th of April,
Yes.
Which is kind of like the main day for People's Health Movement. So in Europe, we almost every year organize different activities. At some point, like it was photo kind of not competition, but people were taking pictures of big banners of People's Health Movement outside their windows or houses and then posting it to the social media. It always depends on the budget. So if we have some money, there were actually involved some creative artists who created like pictograms, and they were shared on social media with the local circles. And this was, I think, quite successful in the past, and we managed to create like our site was quite busy at the time. And there are other things like posting short videos where, for example, some representative from local circles have a short introduction of their group. So there was another kind of thing we did during 7th of April, but it's like a very important day, and it would be nice if we keep this campaign going in the future.
Thank you so much. And I realize that a lot of the things I say are quite theoretical, but I think the action mainly happens on the local level. So we also, like some of the country circles do organize strikes, disruptions. We have also many people setting up community health clinics. So there's also more tangible action, but the global level is more about the analysis and the narrative. This is at the World Health Assembly. Some of the people in the team, Ben, who's also here, and who helped us organize Palestine protests outside the UHA, and leading one of the statements there. Yes, and then as I said, the global level also has thematic circles who organize campaigns, sometimes concrete projects, and would also come together and basically tell the other comrades what's happening in their region and country. So, and that's also a really nice way to share and to kind of come to an analysis and strategy together within these themes. Yeah, so they speak for themselves. Ecosystems, environment, and health. War and conflict, which is the active circle also in Palestine, Congo, Sudan. Gender justice and health. Nutrition, food, land. This is not the correct name, I couldn't find it. Trade and health, health systems, and ancestral knowledge should be set up, but I don't know if they have. We will also ask you at the end, like if you want to be on one of the Google groups of any of these topics. And the current themes on global level, Palestine is very important at the moment. So we actively work with PDS and the Hague group set in Colombia. And we also have a fundraising campaign at the moment for health facilities, both in Gaza and the West Bank, amongst others at the Al-Afda Hospital. We just concluded also a huge meeting with the Miami Forum on land justice, food, and health. So that's a theme we also hope to diffuse within different regions to realize land justice and food justice for all. That's a theme we're not very active in within Europe, but that would be possibly interesting. Global Health Watch 7 has been published recently. Public Pharma is an active program. And in 2 years, there's also the 100 years anniversary of the League Against Imperialism, for which PHM will also prepare something. Yeah, so these are just some pictures from the themes that we're working on. This is Aziz Rali and Hannah Bosselaars, and there's also James Smith, who went on the Global Smooth Flotilla and general organizing around Palestine. I'm talking too much. Yes, and then I will stop shortly, hopefully. So People's Health Movement Europe, yes, who are we? What are we doing? I would say for sure in Europe, we're most strong in the country circles. On a regional level, for what we've done over the last couple of years, basically organize a meeting once in a while to update each other and to invite each other to our campaigns. So we have country circles and we also have active members. So there's, for example, countries that don't have a circle, but people that are active within Europe. And also important to note, we mainly have representation from Western Europe, but there are many comrades from Eastern Europe that are also active. And a big question for us is also how to be a better representation of the European questions, because we cannot do that without them. We have a Google group for updates, monthly meetings, and you can also send your own campaigns and achievements there. And we have revised the regional meeting as we are here today, but there's also network meetings. So I think we also organized the community health meeting, and then it's a European meeting as well, not from PHM, by PHM members. And we try to use these meetings also to meet each other. There was also a public health conference 2 years ago, Manifesta, organized by Diaceutics and Medicine for the People. It's also a place that we usually meet. So apart from the regional meetings, there's also actions that we invite each other to. And this will be what we're going to discuss today and in the afternoon. Can and should we do more, and how can we connect and create synergies within the region? Yeah, and this is, we can send this also afterwards, but there's just some, I would say, documents that have helped shape the PHM vision. So I told you already about the Structure for Health, the PHA5 document, the Global Health Watch, and there's also the Struggle for Health by David Saunders, who was one of the founders of PHM. And there's also many other publications. Yeah, I'm done talking. That's a short introduction on PHM, just for, because I think it's nice that we start all the same level. I don't know if you have any questions for now, and otherwise, we're gonna start the discussion together as well. Yes.
How do you kind of sign up to just receive information about what's happening at the different levels?
Yeah.
It's best to get involved.
Yeah.
Work closer to your local group, or obviously we don't want to be in it overwhelmed with everything that is.
Yeah. So the question was how to sign up. So there's different things. So through a regional group for sure, and through the regional group you should get information from the global. There's no global group. Right, so the region diffuse the global, and then from the global side, if there are themes that you are active in, for example, gender justice and health, then you sign up to that group, and that is a global group. So I would say thematic circles, region, and country circle if you have one, but not all must have. Yeah. And we will also share a list, and then you can just tell us where you want to sign up to. And the list is.
Yeah, so the list is already there. I will actually add PHM Europe because that's also maybe nice if you're here but not in the PHM Europe group yet. So then you get a PHM Europe emails, and then you see there what's already there is the circles on the global level that Juliette just went over. So then we will forward your email address to the responsible coordinator of that circle, and you give it a bit of time and you will get in that group. Yes.
Other questions? No. Then I'm just talking a bit more because what I realized that sometimes people need to have some courage to ask questions, and then we just talk and talk and talk until someone feels that you're comfortable enough to ask the question. So I'm just doing that. If you're doubting, you're very welcome to ask a question still. Anyone? Yes.
Thank you. It was so inspiring to be reminded of all these things, but I'm very interested in how we share information, you know, like research. There's a number of organisations, one called Gesturing Towards the Decolonial Futures, and the Tapestry of Global Tapestry of Alternatives. So these sources of alternative knowledge, of research, etc. I just wondered whether there's a kind of network, or you know, to connect people into those other, which are very like a sister kind of organisations.
Yeah. So I think that's a really good point. I don't think we have that too much, but that's something we can and should think about. I think in terms of communication, websites, bringing knowledge together, that's something we are not doing what we ideally would do. But that's something we can also maybe discuss in the afternoon. I think also collaboration with other existing progressive movements. There's so many movements that are doing the same thing as we are, and somehow we're still on our own. So there's a lot of potential there for sure. So let's discuss it also a little bit afternoon.